Good morning. I wanted to talk to you a little bit about holistic care and holistic doctors. A lot of patients that say, oh, they refer to me as, oh, I'm going to see my holistic doctor. Now, understand there's not really a degree in holistic anything. It's become kind of a buzzword. I I use it all the time, of course, because it defines the way we treat the body, right? So we're treating all parts of the body, looking at all parts of the body, how they interrelate to one another, and using natural methods to treat the body. That really is what the holistic approach is all about. Now, can any doctor use a holistic approach? Sure, you can have a medical doctor who uses a more holistic approach. But as far as a holistic doctor, it doesn't really exist. So we have a medical doctor on the medical side, we have a chiropractic doctor on the natural side. Now there's also naturopathic doctors. They are trained in more natural type methods. They're allowed to do some things we're not, as far as injections and whatnot. That's really what you have as far as doctors go. Yeah, but acupuncturists, they're not doctors. They go to school for a long time. They're not doctors, but they obviously employ a more natural approach. But as far as a holistic doctor, which people use all the time, I love it. It sounds great. It just doesn't really exist as per the definition of a doctor. So it really defines the approach. Now, can people say, "Oh, my holistic chiropractic doctor"? I mean, it's a mouthful. That would be a true statement. That's fine. I just want you to understand that it's really defining the approach that we take. So, as we know with the medical field, they're an emergency field, so they're really looking at the problem that you're coming in with, right? Because that's what their focus is, So if it's high blood pressure or diabetes or your ankle hurts or your knee hurts, they're not looking at all aspects of the body and taking all that into account because it's not how they've been trained. They've been trained to look at the problem that you present with and correct that. So us not being in the emergency field, we can take a step back and look at the body as a whole and really see how all areas of the body are interrelated and how one area does affect the other and take a functional approach to the body. There's no one's better, one's worse. Nope, we're all about helping the person with whatever's going on. Now, if something is not a functional problem and someone's presented to me, then I will say, you need to go get that addressed medically. That's outside the functional realm. Would it be nice if it happened on the medical